Dr. Susan Hopkins is the COVID Strategic Response Director at Public Health England. She advises the government on, among other things, the latest research on the new variants and how they interact with vaccines. I spoke to her just before we came on air and I asked her if infection numbers were coming down as fast as she'd expect.
So our numbers of cases that we're detecting in the community has come down quite fast. It's down by over 30% in the last 2 weeks. But actually what we know is that the hospitalisation, so the people admitted to hospital and those in hospital, lag behind. It's also important to note that, even in those admitted to hospital in the last 2 weeks, that's come down as well, from a peak of about 4,500 about 2 weeks ago to just over 3,100 now. So it is declining. But in a way, the good news is because the treatments got better, people are staying longer in hospital and people aren't dying as fast as they were on the first occasion. And so that means that inpatients in hospital is at a very high level, more than 23,000 still. And we still have large numbers of individuals in ICU getting treatment. And that's going to continue to have pressure on the NHS for the next couple of months.
Are we seeing any evidence yet that the vaccination process is beginning to work in terms of reducing infections?
So I think we are seeing declines in all age groups at the moment, and we're starting to see declines in the over 70s and over 80s. It's a bit early to say whether those declines are directly related to the vaccine. What we'd like to see is the sort of a divergence in the case rate in the over 70s and over 80s who've been vaccinated from the younger age groups to show that they're declining faster.
People may not remember November very clearly by now, but in November there was a kind of great uncorking when pubs and restaurants and some theatres reopened. Social distancing measures were very quickly relaxed. Are we going to see something like that happening this time, or will it feel very different indeed?
Well, as always, the final decisions on this lie with government, but I think we've learned, as we did on the first occasion, we have to relax things really quite slowly so that if cases start to increase, we can clamp down quite fast. The NHS is going to be under pressure until the end of March, as normal in winter, but even more so with the amount of inpatients they still have with COVID-19. Any releases that we have will have to happen very slowly, very cautiously, watching and waiting as we go, with a 2-week period to watch and see the impact of that relaxation, because it takes that to see what's happening in the population. We do not want to have another wave as we've had this winter. This has been a very difficult time for everyone, for people living at home, for people who've watched their loved ones die. So it is better to be cautious. Let's get the population vaccinated. That will have the biggest impact on reducing hospitalisations and reducing deaths.
Now, I know that your specialty is the new variants. That's what you study particularly. There were numbers out this week that the Janssen vaccine was efficacious against the South African variant, but at a much lower level. Should we be worried by that?
So I think we start by the point that the World Health Organization, the US FDA and others, so that an effective vaccine would be one that was reduced the vaccine effectiveness by 50%. So that's where we start point. The Janssen vaccine and the Novavax suggest that it was at least 60% against the South African variant. So I think that is reassuring news. I think that we'll learn more about these vaccinations as we start rolling them out more widely in the population. And I expect that all of the vaccines will have similar levels of effectiveness against places like the South African variant.
Sticking with the variant we know about, the South African one, for instance, are you saying in effect that all the vaccines are likely to be 50% or so effective against that?
So I think it's hard to imagine how the different vaccines won't have similar levels of effectiveness. So I think they would have at least 50%, maybe even more. We clearly will need to study all of them in terms of looking at how they respond to the population in South Africa, where I know there are a number of studies going on at the moment. AstraZeneca have been doing one of their trials in South Africa. And so I think we will learn more both from the laboratory work and from the trials that are happening with these vaccines globally. But I think all of the vaccines have shown very similar levels of effectiveness, very similar levels of vaccine efficacy. And that's very good news. And it means that we really want people to go out and get that vaccine when it's offered to them.
What do we know about mixing and matching first and second doses? In other words, you could have a first dose of Pfizer and then a second dose of AstraZeneca, or vice versa. Do we think that works or not?
So at the moment, we're recommending that people get the second dose of whatever they've had their first dose on, because that's where we have the best evidence. That's what we know works. We'll be, of course, looking to see if we can develop studies where we can study whether a person has one dose of one vaccine and another dose of another. In some other infections, we can see that that's often an effective strategy because it challenges the immune system in slightly different ways. That hasn't been studied for this virus and for these vaccines yet, but we will have answers over the course of the year, no doubt.
What do we know so far about whether these vaccines actually stop transmissibility of the disease? In other words, stop infectiousness?
So we're still waiting for that. We are looking very carefully at the studies that we have ongoing in the UK, where we are monitoring individuals every week to 2 weeks with PCR tests. And we're monitoring those individuals to see whether, after they've been vaccinated, whether those individuals develop PCR positive infections and lateral flow positive infections. One of the studies that I lead on, Siren study, looking at healthcare workers, will hopefully report our first report related to vaccine efficacy and also potential transmissions averted over the next few weeks.
Dr. Hopkins, it's been great talking to you. Thank you so much for joining us.
Thank you very much.